Hi, and welcome to Your Health is Wealth. I'm your host, Dr. Ryder. I am a licensed naturopathic physician. Thank you for joining me today. Our broadcast is here to help you navigate your journey to wellness. We try to make it simple for you without confusing medical terminology. We give you practical solutions to your health issues that allow your body's healing systems to do the work for you. It's simple, it's natural, and it works. If you're struggling with your health, come see us at Naturopathic Physicians Group to help get your life back. And one of the common questions that people have is, what is a naturopathic doctor anyway? So let's talk about that a little bit. A naturopathic doctor can provide primary care. We can also do specialized care, depending on the focus of that particular doctor. But what we do differently is we look at the body as a whole, and we determine the root cause of your symptoms. We treat the cause rather than treating your symptoms. So our intake looks a little different as well. We spend an entire hour with you, taking a full history, asking you thorough questions that you've most likely not been asked by a doctor before. And they're very simple questions. How much water are you drinking throughout the daytime? How many times do you go to the bathroom? What are you eating? We really look at your lifestyle as well, exercise and stress level. We believe that prevention is the best form of cure. We teach patients how to care for themselves moving forward so that you can live your best life. I mean, quality of life is extremely important, and we as naturopathic physicians can help you achieve that. Now, every week we have a different topic that we discuss. On today's episode of Your Health is Wealth, I'll be talking about female hormones, all ages of hormone issues from puberty to menopause and thereafter. And to the men listening out there, if you have a lady in your life, this would be a good episode for her to tune into. Dr. Katz will be doing a solo show about men's health in the future, but today it's for the ladies. Most ladies know when their hormones are off, and also most people around them know that their hormones are off. But some of the symptoms of hormone imbalance include, and I'm going to give you a long list here, acne, fatigue, irritability, mood swings, weight gain, early aging, loss of muscle mass, hair loss, brain fog, menstrual irregularities, insomnia, which is can't sleep at night, anxiety, decreased libido, which means you're just not interested in having sexual relations. You might experience some ovarian cysts, uterine fibroids as a diagnosis. You can have decreased endurance when it comes to physical activity. I mean, there is a lot to discuss when it comes to hormones. Now, thyroid hormone dysfunction can overlap and look similar to female hormone imbalance too. But that isn't what we're talking about today. Today, I'll be concentrating on female hormones. And female hormones can be quite complicated, and I'm sure most people know that. So because of that, it's important to see a doctor who's well-versed and understands the complexity of the female body. Treating hormones is a very individualized practice. It cannot be cookie-cutter medicine because we're all designed so very differently that it's impossible for the same treatment plans and dosages to work for everybody. A physician really should have many tools in their tool bag to be able to effectively manage someone's hormones, because not every female can use hormones as their treatment. Sometimes you need to use other means to get them back to balanced hormone levels. And also, not every female wants to use hormone therapy. So in that case, how do you help that patient's body to produce adequate hormones for her age and allow for her body to effectively use what's already biologically available for her? It's a delicate balance. Now, for childbearing age women, the female hormones fluctuate greatly throughout the month. I mean, the female body is so fantastic. It can grow a human. I mean, isn't that amazing? Isn't that a beautiful thing? But in some instances, the fluctuation can be troublesome for women when it isn't balanced. Think about it. Female hormones fluctuate from one end of the spectrum to the other every single month. So that means our hormones are changing daily. We expect ourselves to go through the same routine every day. We expect ourselves to have a positive attitude, and we get down on ourselves when that doesn't happen. Give yourself some grace. If you're a childbearing age woman, the chemical reactions in your body, they change every day. And then when women reach the age of menopause, their hormones fluctuate again. It's kind of like hitting puberty all over again, but in reverse. The female body is intricate and complex with an amazing innate ability to heal itself, as all of our bodies do, male, female, and child and older adults. But the female body, it can produce a child. She can care for everyone around her. She can run a corporation, start up a business, or become a physician. Women's bodies are worthy of respect, and they're simply amazing in nature. But some women struggle greatly to balance these hormones and all of the issues in her life. And now in my practice, there are 3 different types of typical female patients that I see. And I can talk about those here a little bit. And then you can perhaps maybe put yourself in one of these categories. And do any of these sound like you? Let's see. So I will have the 20 to 30-year-old female who's perhaps been on oral contraceptive pills for most of her life. They want to go off the pill, but when they do, they suffer a variety of symptoms. Could be acne, could be depression, mood swings, menstrual issues. I mean, it can go on and on. And they're young, and they really just want to live their life to the fullest, but they have these issues that they've been dealing with because their hormones have been suppressed for so long. And then the second category I have are 30 to 40-year-olds. They deal with fatigue, irregular menses, uterine fibroids, PMS, many other symptoms that look like the beginning of perimenopause. And then you have the 50-plus age group that I see a lot of, who's going through or has already gone through menopause. They're tired, they have brain fog, loss of muscle mass, seeing great signs of aging, and definitely not happy about it. I mean, did you know that the average woman used to gain about 5 to 10 pounds in menopause, but because of our polluted environment, she now gains about 10 to 20 pounds in menopause? I mean, I don't know of a single woman who's okay with this. But this is what I see. I see a variety of women, some are even teenagers, all the way up through 80s. And these women just desperately need help with their hormones, and they get it. I'm Dr. Ryder, licensed naturopathic physician, and we're here to give you practical information to help you take charge of your health care, to start your journey of getting your life back. If you're struggling with your day-to-day tasks and everything seems harder than it should be or used to be, our doctors are here to help. Our office is located at Naturopathic Physicians Group, 9200 East Raintree in Scottsdale, and you can reach us at 480-451-6161. Typically, I have a co-host with me, Dr. Stephen Katz, but I'm solo today. We discuss a different topic for natural remedies concerning your health every week. Today's topic, female hormones. Do you feel like you're going crazy? Have you been told by your significant other that you are short-tempered or irritable? Is your relationship on the brink of extinction? Is your period irregular? Do you suffer from fatigue or insomnia? Is your brain not as sharp as it used to be? Do you wish to feel and look younger longer? I mean, who doesn't, right? But these are the things I'll be addressing today. Female hormones aren't something that every doctor provides care for. So that includes traditional medical doctors and naturopathic doctors. If you need help in this area, just be sure to do your research and find a doctor who has experience with treating hormones. You would think that gynecologists would be well versed in hormone balancing, but not all are, unfortunately. There's also a difference in the hormones that are offered by traditional medical doctors and the hormones that are offered by naturopathic doctors. And that's something that we'll talk about today. I'll dive deeper into that in a bit. Now, there are bioidentical hormones that are available through compounding pharmacies. And then there are traditional prescription hormone, mostly come in patches in a variety of doses that are available at a traditional pharmacy. So let's just talk a little bit about traditional diagnostic testing and what that would look like whenever you do go to a traditional medical doctor and are complaining of some hormone-related issues. Blood serum labs are traditionally done to check those hormones, and there's a variety of labs that can be ordered. It's up to your doctor which he or she chooses to check, dependent on your symptoms. Often I find when a patient brings their labs into me, it's a little frustrating for me to find that often these aren't run at the optimal time during a woman's cycle. And it really does matter which day of the cycle that labs are drawn when you get your hormones checked. Sometimes a patient will come in and say, my labs were done and everything was normal. And then when I'm checking over those labs, I often find that so many other labs are needed to get a full picture of what's happening. I like to micromanage the levels of those labs. I mean, it's probably the only place in my life that I micromanage, because I promise I'm not a micromanager any other time. But with my patients' labs, I definitely am. But also systemically with red blood cells and iron and cholesterol, inflammatory markers, etc. Those are really great diagnostic traditional tests to take a look at. Another imaging test would be transvaginal ultrasound. And that can come in really handy, actually. I really do to see those tests in my office. They rule out PCOS, which is polycystic ovarian syndrome. They look for uterine fibroids or any other mass or lesion that may be causing symptoms. You want to make sure you don't have any precancerous or cancerous issues or masses in there that might be causing the problem. So, I mean, why all the fuss about hormones? Why might they be out of balance? What causes your body to dysregulate? Shouldn't it just work fine on its own in the way it is? It should, but it often doesn't. And the reasons for that are many, but the biggest one is stress. I mean, simply living our day-to-day lives can be stressful. We can have toxic relationships, a history of abuse, work-related stress. Being a mom, talk about stress. Financial burdens. There are so many reasons that we can experience stress. Our hormones might also be disrupted due to aging. As we age, our hormone production decreases. Our bodies utilize our hormones less effectively. Super annoying. Any life changes that we might have, such as puberty, menopause, pregnancy, and birthing a child. I mean, those are big deals. Certain medications can affect our hormones, like steroids is one example. They actually reduce all of the hormone production in the body. And then there are environmental toxins. I mean, our world is polluted. We breathe in exhaust fumes. We eat plastics and chemicals that are in our foods. Not on purpose, but they leach into the food. These pollutants are called endocrine disruptors. They disrupt our hormone production and also our body's ability to use the hormones that we do produce. Bummer and unfortunate. Some of the traditional treatments that are used in hormone dysregulation include oral contraceptive pills, the birth control pill. Unfortunately, they get handed out like candy. And the reason that they're given, it's not always for birth control. They can be given out for reasons like acne or PMS or irritability or having an irregular period, many other reasons. But these birth control pills, they suppress your hormone production as well. I mean, you can't treat the problem if you don't treat the cause. I'll see patients in my office after several years of battling their symptoms, and they're tired of being on the birth control pill, or they just believe that they should not be using it any longer. And then we're back to square one, dealing with their issues which should have been addressed years ago before being placed on the birth control pill. Also, there's many risks and bad side effects when it comes to the birth control pill. I mean, heart attack, stroke, infertility, breast cancer, blood clots, just to name a few. There's also hormone patches that are traditional treatments, and these can actually be beneficial for many women. Now, they may not be the bioidentical hormones that naturopathic doctors prescribe, but they still have benefits. And I find that they're often not a high enough dosage, though, or optimal delivery method for menopausal women. Other traditional treatments are antidepressants and anxiety prescription medications. Yeah, they're handed out for hormone imbalances, and it's typically when your doctor just doesn't know what else to give you to help you with your hormonal symptoms. They may be just prescribe an antidepressant or an anxiolytic medication, and that can lead to further imbalance of your root cause down the road. It's quite frustrating. Medical weight loss strategies are out there. I know that they seem attractive, but beware. Some of these include prescription-grade appetite suppressants, and you can be left dealing with another problem, like anxiety or depression, that was caused by a side effect of the weight loss medication. I actually had one patient who came to me after they successfully lost the weight, but now they're battling a new and really frustrating problem of anxiety and insomnia. And turns out it was a side effect of their appetite suppressant medication that they were given to lose weight. And sometimes doctors will give PPIs, which is an anti-acid medication, to help someone with hormone imbalance. Oddly enough, it's just sometimes a PPI is prescribed for females' anxiety, or simply because it's not known what else to do. So let's talk about some of the naturopathic testing that we do. Naturopathic doctors have many tools in their tool bag, and we have been able to help women determine where their hormone balance lies and perhaps even what's causing it, because that's what we search for. We use, my favorite is the 24-hour urine test. And it's exactly what it sounds like. A female collects urine for 24 hours, and we send it to the lab, and it measures their hormones, and the metabolites are what we are looking at. If you're just too busy and your life is too crazy to collect urine for 24 hours, I get it. There's also a 5-point urine test where you just collect the urine 5 times out of the day, and that's sufficient. And like I said before, I also like to see the imaging, a transvaginal ultrasound. And periodically, I'll even use this for my menopausal women who are on hormone therapy. Basically, it's used as a safety check to measure their uterine tissue to make sure it's not growing out of control. And then obviously we use blood serum labs as well, and those should be drawn on specific days of your cycle for the best results. The hormones that are tested most commonly are estrogen, progesterone, testosterone. Yes, women have testosterone. DHEA, cortisol, sex hormone binding globulin, and FSH and LH. I mean, we'll even check cholesterol and pregnenolone. And there are other lab markers to check that are important in certain individualized conditions, but those are the main hormones that I look at when running a female hormone panel. I mean, 2 different women can have the same lab result number on the same lab test, but feel different symptomatically than the other one. Even lab values need to be considered subjectively. So one person might feel fine with a high normal estrogen number, but her friend may feel terrible and cranky at that same number. And this is important when practicing individualized medicine. Remember, we're treating the patient, not their lab number. I'm Dr. Ryder, licensed naturopathic physician. If you feel like your health could use a tune-up, we are here to help you regain control of your whole body health. Our office is located at 9200 East Raintree in Scottsdale, and you can reach us at 480-451-6161. Today I'm talking about female hormones and how naturopathic medicine can help get you balanced and back to your old self again. If your doctor has told you that your symptoms are all in your head, drives me crazy, or your labs say that your hormones are fine, but you don't feel fine, then come see us at Naturopathic Physicians Group. Our testing and treatments can get you feeling yourself again, feeling younger, with more energy and improved brain function, the way your body is intended to serve you. We like to take what seems impossible and make it possible. Today's topic is female hormones, and we're talking about the unpleasantries of acne, fatigue, irritability, mood swings, weight gain, early aging, loss of muscle mass. Gosh, this kind of sounds like the side effects of some of the medication commercials. Hair loss, brain fog, menstrual irregularities, insomnia, anxiety, decreased libido, ovarian cysts, uterine fibroids, decreased endurance. Okay, that's enough, even though there's more. But every week we like to give a tip of the week, like to give you a little bit of something to go home with. So this week I'd like to talk about the most common hormone deficiency that I see in my office, and that's progesterone. Progesterone is our feel-good relaxation hormone. And progesterone can actually start to decrease in our 30s. So it's the hormone that keeps a female pregnant when she is pregnant. It's exactly how the root of the word is there, progesterone, so progestation. But even when we're not having a baby, we still have progesterone in our system, and it's still very important. Even males have progesterone in their bodies. But if you have a decrease in progesterone, typically starting in your 30s, it leaves females with heavy menstruation, ovarian cysts, uterine fibroids, and raging PMS. Fun. If you suffer from any of these conditions, you can incorporate some foods into your diet to help produce progesterone. Sesame seeds and sunflower seeds actually promote the production of progesterone. So include more of these seeds in your daily diet if you experience PMS, anxiety, if you have been diagnosed with ovarian cysts or uterine fibroids, if you're just irritable, cranky, and have mood swings around menstruation time. Sesame seeds, sunflower seeds. You can throw them on your salad, just eat them by the handful. They are progesterone promoting foods. Naturopathic doctors like to use food as medicine, and why not? We love to eat, right? And why not promote good health with what we consume on a daily basis? So let's talk a little bit about some causative testing. We like to do a full history intake to determine which tests are the best fit for your symptomatic needs. I talked a little bit earlier about the 24-hour urine hormone testing. This test is my go-to absolute favorite, and it's the most accurate hormone test, especially for menopausal women. And it's exactly as it's named. You gather all of your urine for 24 hours. Most of my patients like to complete this test at home over a weekend, but you don't have to. You can still go out to eat and live your life. Just keep a container with you and keep your urine refrigerated once you get home. The test measures all of your hormones plus your metabolites, and it also tells me how well you're detoxing or processing your hormones that you might already be on. And then it lets me know if you need help in the area of hormone processing. And in naturopathic medical care, everything's individualized. So if that 24-hour urine test is not the best fit for you, there's the 5-point urine test, and that works best for my busy patients or women who are still menstruating. And if you're still menstruating, it should be done during specific days of your cycle. And then we talked a little bit about the blood lab testing that can be done also. And a lot of times this is covered by insurance. You would just have to check on that individually. So we may substitute blood labs in between the urine labs, which the urine labs are not covered by insurance. Most specialty lab testing, such as the urine testing, isn't a medical insurance covered item in any office setting. But let's go back to the females, the 3 types of patients that I see. Remember, we talked about that earlier. I have the 20-year-olds that come to see me, the 30 to 40-year-olds, and then there's the 50-plus group. So treatments for the first 2 types of patients that come into my office, the 20 to 40-year-olds basically, they come in for hormone balancing, and that can vary greatly depending on their situation. If they're coming off of oral contraceptive pills and they're having symptoms, I'll likely supplement them with vitamin B, magnesium, and other nutrients that were wiped out of the body from taking oral contraceptive pills. And it's true, the birth control pill really does rinse specific nutrients from your body. If acne is an issue, I might suggest some vitamin A and maybe some fish oil to promote healthy skin. And we'll check on personal hygiene things, lifestyle factors, diet, simple stuff like that. Do you wash your pillow cover every night? I might look at supporting, not every night, every week, once a week. That would be excessive. We support your detox pathways. If your brain neurotransmitters have been affected and they're experiencing depression or anxiety, and we work on balancing those. And for the 50-plus group, bioidentical hormone therapy. That is what I specialize in. It's extremely effective. It changes women's lives. And a common question that I get is it safe? And I'll talk about that a little bit later. But the answer is yes, but I'll explain a little bit what that means later. And what does bioidentical hormone therapy look like? I mean, how do you do bioidentical hormone therapy? It sounds like it's super high tech or something. When I first heard the term, it made me think of the bionic woman. I'm totally aging myself. I had a bionic woman Barbie doll. I wonder if anybody remembers that. She was so cool. She had a blue bodysuit and little lift-up plates on her arm that revealed her inner mechanics. Gosh, that seems so long ago. I bet you that some of my patients would say that bioidentical hormone therapy makes them feel like the bionic woman. So let's say that all of this sounds really great, but not for you. You just don't want to have to deal with putting on cream or taking a pill, or perhaps you want to age gracefully without the assistance of hormones. There are options out there for women who desire hormone balance but would rather have an alternative to using bioidentical hormone therapy. I have a patient who only used, and I use the word only lightly, used a supplement to manage her perimenopause symptoms, and she reports that it has changed her life. I believe it had dong quai and some black cohosh in it, female balancing herbs. And sometimes all our bodies need are just a little nudge in the right direction to get those hormones balanced and feeling back to our old self again. I mean, natural supplements can be super effective in helping women of all stages of life. Whether you're going through puberty, pregnancy, postpartum, childbearing age, perimenopause, or menopause, there's ways to help. And one simple way is using the food as medicine, as I talked about before. There's a variety of seeds and oils and foods that can promote the natural cycle of a woman's menstruation. And sometimes those detox pathways just need a little help cleaning house so that your body's hormone receptors can do their job effectively. If you feel like you just haven't gotten to the bottom of your medical problem with your doctors and are tired of feeling tired, call Naturopathic Physicians Group. Our office is located at Scottsdale, 9200 East Raintree. You can contact us at 480-451-6161 or find us on the web at naturopathicgroup.com. Our doctors are well-versed in all aspects of healthcare and ready to make you feel whole again. I am from Naturopathic Physicians Group in Scottsdale, Arizona, and I'm here today to help you get your path to wellness and get your life back. I'm Dr. Ryder. Normally I have a co-host, Dr. Stephen Katz, with me, but he's on vacation. So it's just me. You're stuck with me today. Today's topic of the day is female hormones. There's a long list of how those present in your body whenever they're imbalanced. I'm pretty sure you know how that looks, but mainly it's fatigue and irritability, some anxiety, insomnia, and many more. We talked about causative testing earlier, taking a full intake and completing hormone testing. You can use urine or serum blood labs. We can also do some imaging and take a look at the uterus and the ovaries themselves with using a transvaginal ultrasound when needed. So let's talk a little bit more about the treatment options. We'll finish up some conversation from last segment, and we talked about bioidentical hormone therapy and getting your hormones back on track. But before initiating any type of hormone balancing or replacement therapy, I like to get the body's natural functions moving toward peak performance. I will work with my patients on diet and lifestyle changes, if any are needed. Some of my patients are like, they eat cleaner and exercise so much more than I do. And I'm like, goodness, these are goals of mine. But sometimes there are some tweaks that need to be made. Reducing stress and optimizing your detox pathways are really good ways to help out balancing hormones. It's really a whole body process. Nutrient-dense foods and natural supplements are necessary to provide the body with cofactors that are needed in hormone chemical reactions. And sometimes the body needs IV therapy to provide those in a quick and easy way while digestion and absorption issues are being worked out. IV therapy provides the cofactors that are involved in many chemical reactions in the body. And trying to detox without those cofactors, it's like assembling a toy car without all the parts. I mean, you might get the car together, but it just won't function as well if it would have had all the parts. So let's say you've decided to try, or you'd like to try, some bioidentical hormone replacement therapy. And if you ever see that written BHRT anywhere, that's what that is. And I'll explain what that looks like. So hormone therapy is mainly delivered as a topical cream application in my practice. It can also be a vaginal suppository. That's actually the preferred method. It's the most bioidentical availability, in my opinion. You can also get it as a dissolvable troche. That's something that goes in your mouth and dissolves. Or you can have oral capsules or pellets even that are inserted under the skin. The cream is applied typically once or twice a day. And it may take some time to get settled into your specific dose, and that requires regular testing. And so earlier, I asked the question, is hormone replacement therapy safe? Yes, the answer is yes. And let me explain that a little bit. About 20 years ago, Women's Health Initiative put out some research that said that hormone therapy caused cancer, and that put a lot of fear into a lot of people. And rightfully, I mean, research is there to advance healthcare and protect us. However, in 2019, the new research showed that previous research to be untrue. And not only are bioidentical hormones and hormone replacement therapy not cancer causing, but it's actually cancer protective. Hormones are brain protective, they're heart protective, they're gut protective. They protect you all over. So I just want to make sure that my patients feel safe and that we also do regular testing. If I have anybody that's on bioidentical hormone replacement therapy, we're doing a lot of testing throughout the year. And oftentimes their dosage needs to be adjusted. And sometimes I'll have patients call in and say, Dr. Ryder, something is off. I don't feel right. I'm crying at every ASPCA commercial that I see. Or I'm extra cranky and my husband said that I need to come see you or we're getting a divorce. Terrible. So we'll test hormones and adjust accordingly. Perhaps you had a stressful situation that you're dealing with, and that can create a shift in body chemistry. Sometimes a patient needs help detoxing and so that their hormones can work more effectively. It's also subjective and it's tailored individually for each patient. Bioidentical hormone therapy really is customized medicine. This is custom made for the patient at a compounding pharmacy. This is not something that's covered by insurance, unfortunately. It is a cash pay treatment, but I think my patients would tell you that it's worth every penny. Now, also, I do at Naturopathic Physicians Group provide well woman exams as well. So it's not just that I'm handing out hormones. No, we check everything. It is a one-stop shop there. If you need to get a pap smear, if you need STI testing, if you have something going on vaginally that just isn't right, that's something that I can test and treat. I know it's every woman's favorite doctor visit to just check off her list. The American Cancer Society reduced their recommendation for pap smears. Remember whenever you used to have to go get your annual exam once a year, go get a checkup? They've actually reduced that. You don't have to do that anymore, except for every 5 years. If you've not had an abnormal pap or if you've had negative HPV, you're good to go for 5 whole years. That's worth celebrating. But if you need to go sooner than that, we offer treatment for women's health, men's health, primary care, IV therapy. We treat mental health using a modality called neuroemotional technique. All our doctors also specialize in pain management, which might include things like physical manipulations, acupuncture, cupping. We do regenerative injection therapy, such as prolotherapy or PRP. And I mean, we just do it all at Naturopathic Physicians Group. But today we're talking about hormones. So let's go back and talk about the main hormones that I like to look at in a female body: estrogen, progesterone, and testosterone. I mean, estrogen really is essentially the hormone that makes us female. And if it's imbalanced in men, if there's too much in a man, then he'll develop feminine features and larger breasts, a condition called gynecomastia. And if a woman has low estrogen, it can present as vaginal dryness or pain with intercourse. And then let's talk about testosterone a little bit. Females have it too, and it's important to us. It controls libido, muscle mass, and physical endurance. Now, men have more testosterone than women, but too much testosterone in a female will cause facial hair and male pattern balding. I mean, how unpleasant is that? That's just naming a couple. And then we need to make sure that we check our cortisol level and our progesterone level, because they actually can steal from one another. So if one is low, the other one could be high, and vice versa. And then there's that balance that you have to do. And did you know that cholesterol produces all of our sex hormones? I know that we hear a lot that doctors like to give statins to control your cholesterol, even whenever they're not very high numbers. But it's super important to have cholesterol. All of our sex steroid hormones are made from cholesterol. So some women will experience amenorrhea if they're suffering from an eating disorder or have malnutrition. And that's because there's not enough cholesterol to produce a cycle. And then there's a hormone called pregnenolone. It's called the mother hormone. It's not associated with being a mother, but it's because it's second in line from cholesterol. And then from pregnenolone come all of the other hormones. That's why it's called the mother hormone. And research shows that a deficiency in pregnenolone has been linked to cognitive decline and diseases such as Alzheimer's. If any of my patients have a family history of Alzheimer's, I make it a point to check this hormone. I mean, it's very important, and it's really simple to supplement as well. We're here to help you take charge of your own health, increase your quality of life, and support your natural healing processes. It's often simple, and it works. I'm Dr. Ryder from Naturopathic Physicians Group. Please join in next week for another episode of Your Health is Wealth.